So get this. What if your skin, your body's protector, just suddenly decides to evict parts of itself? It actually starts pushing things out from the inside. It's a pretty strange medical mystery, and today we're going to figure out exactly what's going on. Just take a look at this. This is not just some rash. Every single one of those raised bumps is like a tiny eruption, a channel that the skin has literally built to force something out. And it all brings up a really bizarre question. I mean, it's almost like the skin is serving an eviction notice. And you know what? That's not just a clever metaphor. It's incredibly close to the biological truth of what's happening. So let's follow the evidence and see how this whole process works. Right, so this whole phenomenon has a name, perforating dermatosis. Now, I know that sounds super complex, but the core idea is exactly what we've been talking about. It's your skin literally serving an eviction notice to unwanted stuff buried deep inside.
Okay, so what does that actually mean? In simple terms, it means that some kind of unwanted material from the deep layer of your skin, that's the dermis, is being forced up and out through the surface layer, the epidermis. The skin actually builds a little escape tunnel to kick out something it thinks is a problem.
Probably the easiest way to wrap your head around this is to think about a regular old splinter. Your body naturally works to push that foreign object out, right? Well, in this case, the splinter isn't from the outside world. It's something that was generated from within.
And the way it does this is surprisingly organized. First, some kind of damaged tissue, think faulty collagen or elastin, starts to build up deep under the skin. Then, and this is the really cool part, the outer skin layer grows downward and wraps around this junk. And finally, as your skin does its natural renewal thing, it just pushes that entire package up to the surface, and that's what forms those lesions we saw a minute ago.
Okay, so if your body is kicking out this internal splinter, what in the world is it? Well, the investigation points to a couple of key suspects, two of the most fundamental building blocks of our own skin.
Suspect number one is collagen. That's the main protein that gives our skin its strength and structure. And suspect number two is elastic tissue. Those are the fibers that let your skin stretch and bounce back. In these disorders, for some reason, the body gets confused and thinks one of these super important components is altered or foreign, and that's when it starts the eviction process. All right, let's dive into our first case file. The suspect? Collagen. What happens when the body decides its own structural framework has gotta go? Okay, this is amazing. It's like we're looking at the crime scene from two different angles. On the left, you see what it looks like on the outside, these crusted bumps on a patient's leg. But the image on the right, that's the forensic proof. Under a microscope, you can literally see those dark purple streams of damaged collagen being channeled up and out of the skin. That is the eviction live in progress. So what we're looking at here is called reactive perforating collagenosis, or RPC for short. And here's the kicker. It's often a huge clue for a much deeper issue. It's really strongly linked to big systemic diseases like diabetes and chronic kidney failure. The idea is that these conditions can damage tiny blood vessels, which in turn alters the collagen, and that triggers the body to see it as a problem. And something as simple as scratching can set off these lesions, which usually pop up on the outer surfaces of arms, legs, and the torso. And look, this is not just some obscure medical curiosity. Get this, up to 11% of patients who are on hemodialysis for kidney failure end up developing this condition. So for a lot of people, this isn't just a mystery, it's a chronic and pretty distressing reality. Okay, so that's the story when the body decides collagen is the enemy. But what happens when the target is something else, like our skin's elastic tissue? Well, that brings us to our second case file. And this slide just lays it all out for us. On the left, you can see how these lesions can form in these winding, almost snake-like patterns. That's what doctors call serpiginous, and it happens a lot on the neck. And then again, over on the right, the microscope confirms it. You can see the epidermis reaching down to surround and then push out that clumpy, damaged elastic tissue. This one is called Elastosis perforans serpinginosa, or EPS. Now, unlike the collagen disorder, this one is more often connected to genetic conditions like Down syndrome, or it can be a reaction to certain drugs. It also hits men about 4 times more often than women, and the back of the neck is the absolute hotspot. We're talking 70% of cases. So, okay, we've got 2 different culprits, collagen and elastin, but they cause problems that can look pretty similar on the surface. So how on earth do doctors figure out which is which? Well, this part requires some really careful detective work.
Well, it turns out the lesions themselves are really just the tip of the iceberg. The real goal of the diagnosis is to find the systemic problem that's causing the skin to freak out like this in the first place. It's all about connecting the dots between what's on the outside and what's happening deep on the inside.
They basically use a process of elimination, kind of like this flowchart here. For the acquired form, they start by checking for the usual suspects, like diabetes or kidney disease. If those aren't it, they go down a different path, looking into family history or for signs of genetic conditions like Down syndrome, which are often tied to EPS.
But the real smoking gun, the thing that cracks the case wide open, is a skin biopsy. Pathologists use these special stains to make the different tissues light up. And as you can see right here, those extruded collagen fibers are stained bright red. It's just clear, undeniable proof that we're dealing with a collagen-based disorder. Case closed.
All right, so once the detective work is done and you have a diagnosis, the big question is, what do you do about it? How do you manage this constant eruption? Unfortunately, the answer, it's not so simple. You know, this quote from a medical journal really says it all. Treatment is often unsatisfactory. In many cases, the lesions are self-healing, but usually are recurrent. Basically, there's no single magic bullet for these conditions. So what that means is that managing this becomes a multi-front battle. The number one goal is always to treat the underlying condition, like getting diabetes or kidney disease under control. After that, it's all about managing the symptoms. Topical creams like retinoids can help, systemic antihistamines can calm down the itching, which can be really intense, and sometimes they'll even use things like phototherapy. But one of the biggest pieces of advice is just try not to scratch, because that can trigger brand new lesions. You know, these perforating disorders show us this amazing paradox. Our skin is our primary shield against the entire world, but sometimes it turns its efforts inward, attacking the very things that give it shape and strength. It's just a powerful reminder that the most complicated battles aren't always against something from the outside, but are sometimes the ones we fight within ourselves, just beneath the surface.